Hey there, friends. Imagine this. You're sitting at the kitchen table with your loved one, maybe enjoying a cup of tea or sharing a laugh over old family photos, when suddenly they can't speak clearly or one side of their face starts to droop. Could that be a stroke? If you're over 55 or you have a loved one who is, here's something that might worry you. A stroke can happen without any warning, and if you don't act fast, it could lead to permanent disability. Or even worse, it could take them away from you forever. But what if I told you that knowing just a few simple steps could help you save a life? Stick with me because today we're going to learn how to spot a stroke in seniors and respond with first aid tips that could make all the difference in those critical moments. Today, we're diving into something that could help you or your loved ones stay safe, especially if a stroke strikes unexpectedly. I'll walk you through 3 simple steps to spot a stroke and respond quickly using an easy method called FAST that doctors all over the world recommend. We'll go through each step together so you'll know exactly what to look for, why it's so important for seniors, and what to do to get help as fast as possible. I'll also share real stories from people just like you, along with some practical tips to feel prepared and confident. Plus, I'll give you an extra tip at the end to make sure you're ready for any situation. So, grab a comfy seat, maybe a notebook to jot down a few notes, and let's get started on this life saving journey together. Let's break this down into 3 simple steps to spot and respond to a stroke. And I'll explain everything in a way that feels like we're chatting over a cup of coffee at your kitchen table. Let's start with the first step. Use the FAST method to spot the signs of a stroke. I know how much we all want to keep our loved ones safe, whether it's your spouse, your parent, or even yourself. Staying alert can make a huge difference in an emergency. Why is this step so important for seniors? Strokes are one of the leading causes of death and disability for people over 55, according to the American Stroke Association. In the US and UK, more than 75% of strokes happen to people over 65, because as we age, our risk goes up, especially if we have conditions like high blood pressure, diabetes, or a history of smoking. These conditions are more common as we get older, and they can make our blood vessels more prone to blockages or bursts, which is what causes a stroke. A stroke happens when the blood supply to part of the brain is cut off, either by a clot or a burst blood vessel, and without oxygen, brain cells start to die within minutes. That's why recognizing the signs quickly is so critical. It can mean the difference between recovery and long-term damage. The FAST method is a simple way to recognize a stroke, and it's something you can easily remember even in a stressful moment. FAST stands for face, arms, speech, and time. Let me break it down for you. First, check their face. Ask them to smile and see if one side droops or looks uneven. Then, check their arms. Ask them to raise both arms and see if one arm drifts down or they can't lift it at all. Next, check their speech. Ask them to repeat a simple sentence like the sky is blue and listen for slurring or if they can't speak at all. Finally, if you notice any of these signs, it's time to act fast because time is critical in a stroke. A study from the National Stroke Association found that getting help within 3 hours of the first symptoms can reduce the risk of long-term disability by 30% because the sooner treatment starts, the more brain cells can be saved. Let me tell you about Mary, a 72-year-old from Birmingham, UK. Mary was having tea with her husband, Tom, on a quiet Sunday afternoon. They were chatting about their grandkids when Mary noticed something strange. Tom tried to smile, but the left side of his face wouldn't move. It looked like it was drooping, and it scared her. She remembered hearing about the FAST method from a community health talk at her local library, so she decided to check further. She asked Tom to raise both arms, and one arm stayed down. He couldn't lift it at all. Then she asked him to say, "The sky is blue," but his words came out slurred, almost like he was mumbling. Mary's heart started racing. She knew something was wrong, and she suspected it might be a stroke. She didn't wait to second guess herself. She knew she had to act fast. She called 999 right away, and the paramedics arrived within 15 minutes. At the hospital, doctors confirmed that Tom had indeed had a stroke, but because Mary acted so quickly, they were able to give him treatment in time. Tom spent a few weeks in recovery, but he was able to regain most of his speech and movement, and now he's back to enjoying his Sunday teas with Mary. Mary told me, "I'm so glad I knew what to look for. If I hadn't, I might have lost him, and I can't imagine life without him." How can you use this step? It's really simple, and you don't need any medical training to do it. If you're with someone and you suspect a stroke, just remember fast. Face, does one side droop when they smile? Arms, can they raise both arms evenly? Speech, do they slur their words or can't speak at all? If you see any of these signs, don't wait. It's time to move to the next step. You can even practice this with your family to make sure everyone knows what to look for. For example, the next time you're at a family gathering, take a moment to go through the FAST method together. It could be a fun way to learn something important. This method can help you spot a stroke quickly, so you can get help before it's too late, and it might just save a life. Now that you know how to spot a stroke using the FAST method, let's move on to the second step. Call for help immediately and note the time the symptoms started. I know how scary it can be to see a loved one struggling, and you might feel unsure about what to do next, or you might even think, maybe it's not a stroke, maybe I'm overreacting. But trust me, this step is crucial, and it's better to be safe than sorry. Why is calling for help so important for seniors? When a stroke happens, every second counts. Brain cells start dying within minutes because they're not getting enough oxygen. For seniors, the risk of permanent damage is even higher because our bodies don't recover as quickly as we age, and we're more likely to have other health issues like high blood pressure or heart disease that can make a stroke more dangerous. The sooner you get help, the better the chances of recovery, because doctors can use treatments like clot-busting drugs or procedures to remove a blockage. But these treatments are most effective if they're given within a few hours of the first symptoms. In the US, you should call 911, and in the UK, it's 999. Both are emergency numbers that will get paramedics to you as fast as possible. Noting the time is also key, because doctors need to know when the symptoms started to decide on the best treatment. For example, a clot-busting drug called TPA can dissolve a clot and restore blood flow to the brain, but it can only be given within 4.5 hours of the first symptoms, and the sooner the better. Dr. James Carter, a neurologist from London, says, "The first 3 hours after a stroke are critical. Calling for help right away can mean the difference between recovery and disability, or even life and death." Let me tell you about David, a 68-year-old from Chicago. David was playing cards with his wife Linda on a Friday evening. It was their weekly tradition, and they always looked forward to it. But during the game, Linda noticed something wasn't right. David couldn't hold his cards properly. His right arm kept dropping, and when he tried to speak, his words didn't make sense. It sounded like he was trying to say something, but it came out all jumbled. Linda remembered the FAST method from a health segment she'd seen on the news, and she quickly checked the signs. David's face was drooping on one side, his arm wouldn't stay up, and his speech was slurred. She knew it was a stroke, and she didn't hesitate. She grabbed her phone and called 911, telling the operator, "I think my husband is having a stroke. His face is drooping and he can't speak clearly." She looked at the clock. It was 2:15 p.m., and made a mental note of the time, which she told the operator. While waiting for the ambulance, Linda stayed calm and kept David comfortable, making sure he was sitting upright on the couch with a pillow behind his back. She didn't try to move him too much, and she stayed by his side, holding his hand and talking to him softly to keep him calm. The paramedics arrived within 10 minutes, and because Linda had noted the time, the doctors at the hospital were able to give David the clot-busting drug within the critical window. David spent a few weeks in the hospital, but he recovered with only minor speech issues, and now he's back to playing cards with Linda every Friday. David told me, "I'm so grateful Linda acted fast. I wouldn't be here without her quick thinking, and I'm so glad she knew what to do." How can you do this step? It's straightforward, and you don't need to be an expert to get it right. If you spot any signs of a stroke using the FAST method, don't wait. Call 911 in the US or 999 in the UK right away. Tell the operator you think it's a stroke, describe the symptoms, like drooping face, weak arm, or slurred speech, and let them know what time the symptoms started. If you're not sure of the exact time, just give your best guess. It's better to act quickly than to delay. While you're on the phone, the operator might ask you a few questions or give you instructions, so try to stay calm and answer as best you can. If you're alone and you think you might be having a stroke yourself, don't hesitate to call for help. Your life is worth it. This step can help ensure your loved one or you gets to the hospital in time for life-saving treatment, and it could make all the difference in their recovery. With help on the way, let's move on to the third step. Keep the person safe and comfortable while waiting for the ambulance. Um, I know how overwhelming it can feel in those moments. You might be worried, your heart might be racing, and you might feel like you don't know what to do next. But staying calm and taking a few simple actions can make a big difference, and it can help your loved ones stay as safe as possible until the paramedics arrive. Why is this step so important for seniors? During a stroke, the brain isn't getting enough oxygen, and any extra stress, like moving too much, lying flat, or trying to eat, can make things worse. Seniors are also more likely to have other health issues like high blood pressure or diabetes, which can complicate a stroke and make them more vulnerable to additional problems like choking or falling. Keeping them safe and comfortable helps reduce stress on their body and prevents further harm while you wait for help. The American Heart Association recommends keeping the person in a safe position, ideally sitting or slightly propped up, and not giving them food or drink because they might have trouble swallowing, which can lead to choking. They also suggest loosening any tight clothing, like a tie or a scarf, to help them breathe more easily and keeping them warm with a blanket if they're cold. Let me tell you about Susan, a 75-year-old from Seattle. Susan was at a family gathering at her daughter's house celebrating her grandson's birthday. Everyone was laughing and enjoying the party when Susan noticed her brother, Michael, acting strange. His face drooped on one side, and when he tried to speak, his words were slurred. He couldn't even say happy birthday clearly. Susan remembered the FAST method from a health talk at her senior center, and she quickly checked the signs. Michael's arm wouldn't lift, and his speech was off. She called 911 right away and noted the time, but she knew she had to do something while waiting for the ambulance. Susan helped Michael sit down on a chair in the living room, propping him up with a cushion behind his back to keep him comfortable. She made sure he didn't try to eat or drink anything, even though he gestured toward his glass of water. She'd heard that could be dangerous during a stroke because he might choke. Susan also loosened his tie and put a light blanket over his lap since the room was a bit chilly. She stayed by his side, holding his hand and talking to him calmly, saying things like, "Help is on the way, Michael. Just hang in there. We're going to get through this together." The paramedics arrived within 15 minutes, and Michael was taken to the hospital, where he received treatment. Because Susan kept him safe and comfortable, Michael didn't have any complications like choking or falling, and he's now in physical therapy working on his recovery. Susan told me, "I felt so scared in that moment, but I'm glad I knew what to do. It made me feel like I was helping him, and that meant the world to me." How can you do this step? It's really easy, and you don't need any special skills to do it right. Once you've called for help, help the person sit in a comfortable position, ideally upright or slightly propped up with a pillow behind their back. If they're lying down, gently raise their head and shoulders, but don't move them too much because sudden movements can make things worse. Don't give them food, water, or medication because they might have trouble swallowing, which could cause choking. If they're wearing tight clothing like a tie, scarf, or belt, loosen it to help them breathe more easily. If they're cold, cover them with a light blanket to keep them warm, but don't overheat them. Stay with them, talk to them calmly to keep them relaxed, maybe tell them a comforting story or just let them know help is coming. If they become unconscious but are still breathing, gently roll them onto their side into the recovery position with their head tilted back to keep their airway open. This step can help keep your loved ones safe until help arrives, giving them the best chance at a full recovery. Now that you have these 3 steps to spot and respond to a stroke, let me give you one extra tip to tie it all together. Share this knowledge with your family, friends, and neighbors to create a support network. I know how much we all want to feel prepared, and having others around you who know what to do can make a big difference. It's like having a safety net for you and your loved ones. Why is this so important for us? Strokes can happen at any time, and you might not always be the one who's there when it happens. For example, your spouse might be at a friend's house, or your parent might be at a community center when a stroke strikes. If your family, friends, or neighbors know how to spot a stroke and respond, it increases the chances that someone will act quickly, no matter where you or your loved ones are. This is especially important for seniors because we often spend time in different places. Maybe you're at a church group, a book club, or a family gathering. Having a support network means more people are looking out for each other, and that can save lives. Dr. James Carter says, educating your loved ones about stroke signs is like building a safety net. It can save lives because the more people who know, the better the chances of getting help fast. Let me tell you about Helen, a 70-year-old from Manchester, UK. Helen learned about the FAST method from a community health workshop at her local senior center, and she thought it was so important that she decided to share it with her family. One Sunday, during a family dinner at her house, she gathered everyone around the table, her kids, grandkids, and even her sister, and explained the FAST method. She made it fun by turning it into a little game. She asked everyone to smile, raise their arms, and repeat a sentence so they could practice spotting the signs. Her grandkids giggled as they tried to slur their words on purpose, but Helen made sure they understood how serious it was. She also wrote down the emergency number, 999 in the UK, on a piece of paper and stuck it on the fridge so everyone knew what to do. A few months later, Helen's daughter, Emma, was visiting a friend when the friend's father started showing signs of a stroke. His speech was slurred, and he couldn't raise one arm. Emma remembered what her mom had taught her at that family dinner. She used the FAST method to confirm the signs, called 999, and kept the man comfortable until the ambulance arrived. The man was taken to the hospital where he received treatment, and he recovered with minimal damage. Emma called Helen that evening and said, "Mom, I wouldn't have known what to do if you hadn't shared that with us. I'm so glad you did because I helped save his life." Helen told me, "I felt so proud of Emma, and it made me realize how important it is to share what you know. It really can make a difference." How can you share this knowledge? It's simple and it doesn't take much time. Next time you're with your family or friends, maybe at a family dinner, a coffee morning, or even a Zoom call, take a few minutes to explain the FAST method. Face, arms, speech, time. You can make it fun by practicing together, like asking everyone to smile or raise their arms, just like Helen did. Share the emergency numbers, 911 in the US, 999 in the UK, and encourage them to act fast if they see the signs. You can also write down the FAST method on a piece of paper and stick it somewhere visible, like on your fridge or near your phone, so it's always there as a reminder. If you're part of a community group, like a church, a senior center, or a book club, consider sharing this information there too. Maybe you can even organize a little workshop or discussion to spread the word. This extra step can help create a support network so you and your loved ones are always prepared, no matter where you are. Before we wrap up, let me give you a little bonus tip to help you feel even more prepared. Keep a small emergency card in your wallet or purse with key information, just in case you're the one who needs help. I know we don't like to think about something like a stroke happening to us, but being prepared can give you peace of mind, and it can help others help you if you're ever in trouble. Why is this bonus tip helpful for seniors? Many of us live alone or spend time on our own, and if a stroke happens when you're by yourself, you might not be able to call for help right away. Having an emergency card can make sure that someone else, like a neighbor, a friend, or even a stranger, knows what to do if they find you in distress. It can also help paramedics get important information quickly, which can speed up your treatment. Let me tell you about George, a 66-year-old from Boston. George lived alone after his wife passed away, and he was always a bit worried about what would happen if he had a health emergency. He'd heard about strokes at a senior health fair, and he decided to be proactive. He made a small emergency card using an index card he had at home. On it, he wrote his name, his emergency contact, his daughter Sarah, and her phone number, along with a note that said, "If I'm showing signs of a stroke, drooping face, slurred speech, weak arm, please call 911 immediately." He also listed his medical conditions. He had high blood pressure and the medications he was taking, just in case paramedics needed to know. George kept the card in his wallet right next to his driver's license, so it was always with him. One day, while he was at the grocery store, George started feeling strange. His speech became slurred and he couldn't lift his right arm. A kind stranger noticed he was struggling and asked if he was okay. George couldn't speak clearly, but he managed to point to his wallet. The stranger found the emergency card, read the instructions, and called 911 right away. She also called Sarah, who met George at the hospital. Because of the card, the paramedics knew exactly what to do, and George got treatment quickly. He recovered with only minor weakness in his arm, and he's now back to his daily routine. George told me, "That little card saved my life. I'm so glad I had it with me." How can you make your own emergency card? It's really easy, and it only takes a few minutes. Grab a small piece of paper or an index card and write down your name, your emergency contact's name and phone number, and a note that says, "If I'm showing signs of a stroke, drooping face, slurred speech, weak arm, please call 911 in the US or 999 in the UK immediately." You can also add any medical conditions you have, like high blood pressure or diabetes, and any medications you're taking. Keep the card in your wallet, purse, or pocket, somewhere you always have it with you. You can even make a second card to keep at home, maybe on your fridge or near your phone, so it's easy to find. This bonus tip can give you peace of mind knowing that you're prepared, even if you're on your own. Let's recap everything we've covered today. We talked about 3 simple steps to spot and respond to a stroke in seniors, plus 2 extra tips to help you stay prepared. First, we looked at using the FAST method to spot the signs of a stroke, checking the face for drooping, the arms for weakness, and the speech for slurring, and remembering that time is critical. Then, we talked about calling for help immediately and noting the time the symptoms started to get help as fast as possible. Next, we explored keeping the person safe and comfortable while waiting for the ambulance to prevent further harm and give them the best chance at recovery. After that, I gave you an extra tip. Share this knowledge with your family, friends, and neighbors, because building a support network can save lives. And finally, I shared a bonus tip. Keep an emergency card in your wallet with key information so you're prepared even if you're on your own. Together, these steps and tips can help you act quickly in a stroke emergency, giving your loved one or yourself the best chance at recovery so you can keep enjoying the things you love, like playing cards with your spouse, going to family gatherings, or just sharing a quiet cup of tea with someone you care about. I know the thought of a stroke can feel scary, especially when it could happen to someone you love or even to you. It's natural to feel worried about something so serious, but you don't have to feel helpless. Just knowing these simple steps can give you the confidence to act fast and make a difference in a critical moment. You deserve to feel prepared, safe, and ready to protect the ones you care about, no matter your age. As Dr. James Carter said, every second counts in a stroke. Knowing what to do can be a lifesaver, and it's one of the most powerful things you can do for your loved ones. So let's make a promise. This week, take a moment to share the FAST method with someone you love, maybe your spouse, your kids, or your neighbor, and make that emergency card to keep in your wallet. These small actions can make a big difference, and they'll give you peace of mind knowing you're ready for anything. You've got this, and I'm here cheering you on every step of the way. If you found this video helpful, I'd love for you to give it a thumbs up and subscribe for more health tips for seniors. Your support means the world to us, and it helps us share more ideas to help you live your best years with safety, confidence, and joy. I'd also love to hear from you in the comments. Have you ever had to help someone during a stroke? Or are you planning to share the FAST method with your family? Maybe you've already made an emergency card, or you're thinking about doing it this week. Let me know. I read every comment, and I'd love to hear your stories. For more tips on staying healthy after 55, check out our video on managing gout pain with a healthy diet. It's full of practical ideas to help you feel your best. Take care, stay safe, and I'll see you in the next video. Bye for now.